Imagine a normal day. You have a patient that checks in. He's got low back pain. You've worked with him before. Everything seems normal. He's improving, has no complaints today. He gets on the treadmill for 10 minutes to warm up and everything is going fine. Then all of a sudden, boom, your patient hits the floor off the treadmill. What you didn't know that day was that patient had saddle anesthesia, numbness and tingling in the groin, buttocks, and thigh area. This could have been prevented simply by asking the patient, do you have numbness or tingling in the groin? Since I believe in these red flag questions, we're going to go over how they can be put into a screening subjectively and objectively. We're going to look at the red flag questions themselves and how we can use them in order to prevent injuries. Hefner, Fox, and Schwab wrote on the effectiveness of red flags that they can be signs and symptoms of serious pathologies, such as cancer, forms of tumors, diabetes, and things of that nature. They're necessary in order to determine that, one, if we can prevent a patient from doing exercises that aren't safe, and if they even need to come to our clinic, or if what we're doing that day is right for them. Certain symptoms can prevent a patient from doing exercise safely, such as quada equina, or uncontrollable bowel movements. Certain restrictions in movement or certain pains can also be reasons why we decide to limit a patient that day or decide not to do treatment at all. There are also physical signs that may point to a patient needing services in other clinics versus just physical therapy. Maybe there's a shoulder that has been out of place or dislocated. That patient may need to go to chirotherapy to get an adjustment. Or say that there's intense pain with the patient that we just can't treat and it's uncontrollable. That patient can go to pain management clinic in order to be seen. So there's important questions that we need to ask as far as a subjective outcome when we're talking about red flags. You can ask if there's a history of minor or major trauma. This can be indicative of a possible fracture, as well as age, which plays an important part. 50 years or more can be signs of a patient not being able to heal, as well as a younger patient may. They're also prone to falls and fractures as well. This is coming from Dr. Pamela J. Lear and Dr. Tony Rodley in Documentation of Red Flags by a Physical Therapist. A history of cancer, past, present, can increase the risk of that person actually having cancer. Back pain may be caused by metastatic tumors from the kidney, thyroid, or prostate, breast, and lungs. You will also want to ask the patient, do you have any unexplained weight loss, especially if it's over 10 pounds in 3 months, not directly related to maybe a change in diet or working out. This may also be indicative of cancer. You want to ask the patient about rest. Are you having night pains, or are you having sweats that you can't control? When you lay down, do you have pain? Does it get better at all? So having pain, not being able to get rid of it, nothing makes it better, especially at night, is also indicative of a cancer patient. Saddle anesthesia, of course, that I talked about earlier, the abscess of sensation within the groin area, within the thigh and the buttocks area, can also be a sign of what's called quada equina. You may have uncontrollable bowel movements. These are all things that are important to us. Not only just to say if a patient can safely do these exercises, but documentation as well. Because a patient may leave the clinic and have an accident or an incident, we need to be able to tell a provider exactly what we saw when they were here. So there's also objective observations. So know your patient. A patient may come in and sweat more than what they usually do. Maybe there's an increased heart rate or something going on that pertains to an illness that they need to kind of slow down treatment. They may have tremors or shaking that you notice. And if it's not normal for a patient, that may be a sign that says maybe what we're doing isn't working at the moment, or maybe we need to slow down and figure this out. Red flags are a great tool used to determine underlying problems with a patient. At the same time, Davenport and Sebest, wrote the physical therapist as a diagnostician. Pertaining to diagnosis of a patient, red flags by themselves have a low level of actually diagnosing these pathologies. There has to be other things involved. Multiple red flags at once, further tests, diagnostic tests in order to give a diagnosis. However, that's not our goal here. In my opinion, it's better to be safe than sorry. So having these red flags present for us just lets us know whether we need to slow down with treatment or not. So although red flags have a low predictive value, it's much better to utilize these tools that we have in order to make the difference from a patient falling down, of a patient hurting themselves or passing out and hitting their head, and us not knowing anything about what's going on. So for example, today I had a patient who had a seizure. When he came in this morning, I asked why he had missed a previous or prior appointment. He told me that he had already had a seizure previous. That right there let me know that I need to kind of watch this guy closely. Upon further investigation and asking him questions, I found out that he had a previous history of seizures from a while ago. He's undergone other surgeries and other procedures in order to help this process. With that being said, I know that I need to watch this patient closely and make sure I ask questions after each exercise. He then went to the arm bike to warm up for 10 minutes. I asked him after the arm bike, was he okay? He said yes. I did notice he's sweating a little bit more than normal, but I thought maybe just because of fatigue. But still in my mind, I knew he had a seizure. I had already asked my questions, red flags were up, so I needed to keep an eye on him. After the next exercise using black TheraBand for arm extensions, he seized up. And because I knew that he had issues already going on, I was able to react a lot more swiftly than if I thought the patient was normal and improving like he should. And I might not have been paying as much attention. He could have fell, he could have hit his head, he could have seriously injured himself more than what was already going on. So I say this as saying, use red flags as our tools. And don't be the guy or the girl not using them and have an incident on your hands. Thank you.